Chapter 10, Speech and Communication. What are these two trying to tell one another? If I ask you to say one word that you think relates best to this photo, what would it be? I think of love. Now that might seem funny to you, but it looks like this child really loves the doggy, and the doggy does not mind the child kissing. We know that people express their feelings for one another through their speech and also through body language. And this is just one case of that. Well, who ends up in speech therapy in public schools? Most of the time it's more boys because girls develop verbally faster than boys do, for the most part. Sometimes children with other kinds of special needs also need speech therapy. A good example of that would be a child with some kind of a physical issue like cerebral palsy. If that affects the muscles of the throat, then that child's probably going to need speech therapy. Slide 3 tells us that probably around 18% of special ed students are in speech therapy. So if you had 100 children from a school who were in some kind of special education, that would mean at least 18 of those were getting therapy. Now, some of those children might have some other condition, could be learning disabled and stutter, might be intellectually disabled and have problems with morphology and changing word endings and things like that. But usually about maybe 5% of school population receives therapy. Speech therapists have very high caseloads, around 60 children in many situations. Students are usually seen a couple of times a week, sometimes in small groups, sometimes individually. When a speech therapist is planning a group, she wants to try to get children who are close in grade level and close in age, and also children who have similar therapy needs. Otherwise, it can get a little bit confusing. So many times they may take, say, 5 or 6 first graders who all need help with articulation, and they go at the same time every week for 2 or 3 sessions a week. Sessions usually only last about half an hour. What are some of the errors that people make? Well, slide 6 gives you some of those. Communication involves encoding, transmitting, and decoding. Look in your textbook and see what those terms mean. You have to remember that language is a system of communication that is used by a given people group, and speech is very complex. So in some instances, people gesture more in their country when they're speaking. Some places, people just make sounds and don't use words very much at all. It just kind of depends on the culture and how far removed a person is from civilization many times. Some languages are easy to learn for Americans and some are not. A child who has a speech disorder has some kind of difficulty either understanding or producing speech or oral language. If you look in your textbook on page 237, you'll see some of the main types of language disorders. And here's a YouTube video for you. You might learn a little bit about speech and communication from watching that, and then come back and go to slide 9. Here's 3 types that you need to be familiar with in particular, because you'll see most children who are in speech therapy are in it for one of these 3 reasons. Not all, but many. Child may have trouble with voice quality. Your child talks very high. They have a high pitch to their voice. Or the child talks very low or rough. Now when I do this, I'm not mocking people. I'm trying to illustrate to you what some of the conditions may be. Articulation, the way a child pronounces words, particularly things like consonant blends, consonant digraphs, and so forth. If you look on YouTube, you can see examples of some of these. Also, by the way, there are just too many for me to post here. Some people also have a problem with fluency, their rate of speech. The person may talk so slowly because they have a processing disorder that you find it uncomfortable to follow what she says. Or the person may stutter or stammer when saying words. That's also a fluency problem. And of course, as you can see with these football players, being able to articulate and pass on what you want to do very quickly is important. How about slide 10? Language disorders involve comprehension and the use of language. In other words, are you understanding what you hear? Now, sometimes the person is not understanding what they hear because they actually are deaf or have a hearing issue. I myself have a moderate hearing loss, so sometimes I don't hear especially the beginnings of a sentence or the endings of a sentence if the person lowers their voice too much. Also can involve difficulties with what's called the form and function of language. In other words, the right way to put words in order in a sentence to make sense. Or understanding someone. Let's say someone who is an English as a second language student, and they may not put the verbs and the nouns in the correct order for us to understand, us meaning we Americans. Another issue is phonology. Now, if you've taught me all my life that F means F, the F sound, and then you try to teach me that PH means F for phone, I may have a hard time understanding that when I look at the written word phone. Because I thought when you taught me to sound out words, it's pony, even though that does not make any sense. That's not a normal English word. So some children have trouble with that, and they have to really memorize all the different sounds that letters make. They don't catch on to it very naturally. Other children, especially younger children, have trouble with what's called morphology. In other words, learning to use words in the present tense, past tense, future present tense, and so forth. They have a lot of trouble with those endings, but that's normal for children who are 2 years old or 3 years old, even 4 or 5 years old. They may have problems with either one of these, but with proper therapy or maturation or a combination of the two, the child may be able to do better. Syntax is a very interesting term because it has to do with the way words are placed in a sentence. And I give you a very simple example here, but the dog bit the baby means something very different than the baby bit the dog. I'm sure you'll agree with me on that one. And one might give you more cause for concern than the other, just depending, I guess, on whether you like your child better or the dog. Oh my. No, I didn't say that, but I did. There I just used a silly word that we often mispronounce. Okay, slide 13. Semantics. The way that you say a sentence can have different meanings. For instance, if I meet the young lady you see in this photo and I say, "I love your hair," what will she probably think? She'll probably think that I like it and that I admire it because she's showing her individuality. However, if someone sees it and says, "I love your hair," then they're probably being sarcastic. How do you know that? Well, sometimes it's the emphasis on certain words. Think of a sentence that you can say, and by emphasizing different words, you may offend someone, or you may make someone very happy. Try it and see. Pragmatics. Some people have a lot of difficulty in knowing when they should say certain kinds of things and in what situations it might be appropriate to use certain words or language. I'll give you an example. I have a Facebook page. Even though that's not usually oral or verbal unless someone is attached to video, if I look on a Facebook posting and I see that someone has used some words that I consider bad language, as in, I do not mean inappropriate English, I mean curse words or words that I consider vulgar, a lot of times I will unfriend that person because I don't want to see that. Same thing in person. I once had a student here at Charleston Southern who told a joke and used a bad word in the joke in front of me. I immediately frowned and walked away. The person looked very puzzled as to why that word offended me. Well, some people just don't realize that the setting I'm in, not that it's ever right to say a bad word, I will say that, but the setting may mean that certain people will not like the way I'm saying something, or that I brought up a certain topic and they find it offensive. So, word to the wise, as they say, think before you speak. Students you may have who will have a lot of trouble with that, maybe English as a second language students, because they don't always understand jokes that Americans use. Same thing if you go to Britain. They may say a phrase that's very humorous to everyone in the room but you, and you're thinking, why was that funny? Because you don't understand the terms, or you don't know the terminology or the words that are being used. Well, that's an issue having to deal with pragmatics. Here's one I just love. Dialect. Have you ever been teased about the way you speak? When I first moved to South Carolina in 1970, I had a very Midwestern sounding accent. Now, obviously, that left me long ago because I have a very Southern dialect now. But I remember coming here to South Carolina to see my grandparents back in the 1960s, and if we went to church and I was asked to read a verse in Sunday school class from the Bible, oh, I know, Snowball, someone's walking down the road. She does get excited, doesn't she? That's her way of expressing herself and telling Mommy, beware, Mommy. There's something out there you need to notice. Well, enough about her. But dialect. Anyway, I would come down here and read to a Sunday school class, and the students would say, she must be really, really smart. Listen how she talks. I like to hear her read. And I thought that was very strange because I didn't see where the way I read was any better than anyone else's. And of course it wasn't. It was just I had that Midwestern dialect, and most of the children that were in class with me had heard the Southern dialect most of their lives. And I put this humorous little chart up here for you to see. Think about the way we say some of these phrases. Some expressions that maybe you heard your parent use, a grandparent, great aunt, uncle, someone like that, and the way that they said it was considered very funny. But even more so if someone who was not, as we say in the South, not from around here, said the same phrase. We're going to move on now to causes of speech disorders. There can be birth defects that cause things like you see in the visual here, something like cleft lip, cleft palate, which is the upper part of your mouth. The good news is that doctors can usually fix that, sometimes even in utero. Surgery is performed before the child's ever born or shortly thereafter. And something like cleft lip or cleft palate is very easy to fix. Sometimes brain disorders, though, may cause a speech problem, or again, some kind of hearing disorder or muscular condition. When doctors and therapists know why a child has a speech disorder, this is an organic cause. Okay, for instance, could be genetic, some kind of brain disorder. Okay, or again, hearing disorder. A functional speech disorder comes about because of modeling and what happens when the child's at home, usually. And if a parent has a speech problem, then the child may pick up and mispronounce certain words or certain parts of words incorrectly because who's taught them to speak? Their parents. There are some other causes of language disorders. The first one, I once knew a student when I was special ed director who had selective mutism. He would not speak at school, would not speak if an adult was present. Now, the children would report that he did talk sometimes on the playground. Well, the speech therapist was trying to say, how can I analyze this child's speech because he never will talk in front of me or in front of any of the adults. So I decided I will go to the child's home. And they lived in a trailer out in the country. Got out of my car, walked around the end of the house, and I saw the child sitting on his grandmother's front porch. He was talking. As soon as he saw me, he was quiet. I went in the house, talked with his mother, and left a tape recorder with her for one night. And I asked her, I said, would you please record when he's talking? Because the speech therapist would like to hear it. But don't let him know that's why you're recording. In fact, please don't even let him know you have a tape recorder turned on. Okay, said Mom. Now, I'll be honest, Mom appeared to me to be somewhat intellectually disabled herself, but she seemed to understand. So, next day, I went back to the house, got the tape recorder, and the mom said, well, he wouldn't really talk much on it. Okay, I said. Took the tape recorder back to my office, turned it on, and what did I hear? All I heard was Mom saying, talk, boy! I told you to talk! He wouldn't say a word. Oh well, wasted trip. I don't think Mom really understood what we were trying to do. But there is therapy for selective mutism, and I've read a good deal about that. Most of it involves showing the child pictures, letting the child play games, and hoping that eventually the child will be comfortable enough around the speech therapist or the teacher that the child may talk. Sometimes it's happened really because of PTSD, something dramatic that's happened in the child's life. But in the case of the boy I was talking about earlier, he had what's called selective. That means he is choosing not to talk in certain situations, although he was physically capable of talking. Now, sometimes children have language disorders because they have some other disability, like being learning disabled. Again, it can be a congenital disorder, meaning it happened from birth. Could be due to trauma, could be due to an accident that the child was in, where the vocal cords were damaged, or perhaps the trachea was damaged, or some kind of traumatic brain injury. The child was in a car accident or something, and the speech part of the brain was damaged. When should you refer a child? Well, if you have a student who consistently mispronounces words after you have attempted to correct that, child will not speak, child has a lot of trouble being understood or even understanding what others are saying, or child who stutters, that would be a time to talk to the speech therapist about referring this child. Here's some other tips for you. If you have a child who has a speech problem, let the child practice using language correctly in what are called naturalistic settings. In other words, and many of the times this will be a very young child, so those of you in early childhood will probably have more opportunities to do this. But let's say you can let the child go into the kitchen center if you have something like that. Or playing a game with other children, putting puzzles together, using manipulatives. And in those instances, listen to the child talk. And then you can better inform the speech therapist about what's going on. Be a good role model yourself when you're modeling the English language for children. Make sure you're saying the endings on words. Those of us in the South tend not to say that. We will say things like, oh, she was running down the street to catch up to her loose cat. Where we should say she was running down the street, etc. Also, though, avoid overcorrecting a child. If you are constantly finishing a sentence for a child who stutters, or you're constantly correcting a child's grammar, the child may say, why should I talk around this person? Everything I say is wrong or bad. And also, don't let other children tease a child who may have some kind of speech problem. Let them know, hey, we all have differences, and, hey, would you like people to talk about you because, of some issue that bothers that child? I once worked with a young fellow who was in about 5th grade. He stammered and stuttered a good bit. During the time he was in my class and in the regular class at my school, most of that went away. This child had been adopted, but something happened in the home, and he was sent to live in a group home. I went to visit with him, and he was stuttering more than I'd ever heard him stutter. The trauma of things that happened and being removed from a home where he'd lived for a couple of years already seemed to have really, if you want to use the expression, done a number on him, and he'd regressed significantly, which is pretty sad. And where he was in the group home, he was enduring a lot of bullying and teasing because of the way that he talked, which I found to be very sad. So always try to be supportive of children who are working on improving their speech, as well as children with any other kind of disability. Remember, if a child stutters, give them time to finish the sentence themselves. Don't try to rush through or finish it for them. And same thing with adults. Adults who stutter or stammer are embarrassed, and they get very frustrated when people try to finish their sentences. Just give them time to say what they want to say, and they will see you as far more accepting. Keep in mind also, people who speak other language don't always pronounce syllables or even some letters the way that you might. Here's a link down here that's on YouTube that you can click on, and it's kind of fun. It starts out having you pronounce some words in German and then seeing if you can remember the words, and then you can switch and pick another language, and there's maybe 10 or 12 languages there that you can pick from. And see how you do on those little quizzes. It won't take very long, really. It only takes about 5 minutes, and it's sort of fun. At least I thought so. And then when you're finished with that, come back. I hope you've learned a bit about speech therapy from looking through your textbook, and make sure you bring that to class. And have respect for speech therapists, because they all have master's degrees, and they at least a master's degree, and they have studied a lot about how to help people improve and communicate, and we know that's a very necessary skill. If we can help children while they're young to improve their speech and communication skills, they'll get along far better in school, and of course when they go out into the world of work, they'll be seen in a much more positive manner. Thanks for listening today.